Healthy Montgomery Transforming Communities initiative really brings together partners from various sectors to address the social determinants of health. And this can range from addressing food insecurity and increasing food access to creating safe and active communities.
With TCI, we've moved toward a more comprehensive view of how to influence healthcare and looking at broader opportunities to make a difference in building infrastructure in our community.
The TCI partnership began in 2016 and was funded through Trinity Health, one of the largest Catholic healthcare systems in the country.
The Montgomery County Food Council is an independent nonprofit that brings together all of the government agencies, businesses, nonprofits, and local residents who share a commitment to cultivating a robust, sustainable, and equitable local food system.
Our collaboration with Montgomery County Food Council is a very successful one. We are working in several initiatives right now that address the recommendations of the Food Security Plan. One of those initiatives is the data collection project on children under the age of 5, which is one of the populations of which we didn't know much about when it comes to food insecurity.
So the Food Council brings together about 200 partners every year through our working groups and through other initiatives. And by developing that relationship with MCPS, we both strengthen their relationships in the community, and then we also better connect our community to the resources that are available through our school system.
Food Security Plan is particularly important because we're not the only agency, and we shouldn't be, that is offering food assistance. So this allows us, with the Food Council's help, to coordinate efforts to avoid duplication and to identify gaps.
Montgomery County is one of the wealthiest counties in the United States. But what is not necessarily known, even here in our own communities, is that over 60,000 residents are at risk for hunger. And so that means that plenty of our residents, children, seniors, new Americans, are residents that experience physical and mental disabilities. Those residents may not know where their next meal is coming from.
I also don't waste any opportunity to go out in the community and meet people, meet our clients, meet the people who are receiving benefits, meet the people who are accessing those food assistance services. Because I think that if you don't listen to those voices, we would be doing a lot of work but not being efficient.
Since joining the TCI, we've had a number of successes that we've been able to celebrate with our partners and are really proud of.
The Food as Medicine program started as an initiative that aims to connect the safety net healthcare programs in Montgomery County with food assistance, nutrition education, and community engagement.
This program is very critical for our communities because it not only brings access to healthy food, but it also brings hope that diabetes is not something that is going to stay with them for the rest of their lives. If we switch our diet, to fresh fruits and vegetables every day, we have seen results.
BMI among participants was reduced significantly among those who completed the 12-week program. The average weight loss was around 8 pounds. And then for patients who did have diabetes, over 60% improved their control of their diabetes. So it's this great network of providers all committed and with lots of support from the county government to providing health services to those low-income uninsured who don't qualify for any other type of health coverage.
Tobacco 21 is an effort to raise the minimum legal sales age on all tobacco products to 21 years of age. We have had an amazing group of youth advocates who have shared their story and their voice and have worked with their peers to come and testify in Annapolis, to be able to post messages on social media, do videos, call their legislators and email them to say, this is why we need this. In Maryland alone, over 13% of high school students currently use an electronic cigarette. We haven't seen these numbers in decades. I've been working on this legislation for a number of years, and before TCI, we didn't have the same kind of youth involvement. It became a vehicle to allow for those youth, their voices to really be heard because of funding, because of the community. To this year coming to Annapolis, and every legislator that I talk to, I can hear, oh, you're working on Tobacco 21? I know what that is.
Through the TCI, we bring together the Montgomery County Public School System along with the Montgomery County Department of Transportation with the overall aim to increase the number of students that walk or bike to school. This initiative is important because it increases physical activity, it improves air quality, it enhances traffic safety, and also increases academic achievement.
We work with Montgomery County Public Schools either through the specific school administration. We'll get contacted by a principal or another staff member and ask us to come to their school and help out with the issues they may have.
The Montgomery County Public Schools is the largest school district in the state of Maryland. So the local school wellness council, it gives the school the opportunity to make sure that they're compliant. And once they're compliant with their wellness regulations, the school can assign goals that they want to work on to enhance student health and wellness.
School wellness is a broad thing, right? There's staff wellness, there's student wellness, there's community wellness. So to truly make a significant impact on all of those different wellness initiatives, you need a local council or wellness team.
We have schools that have a focus on mindfulness. That is where students become accountable for their emotions and their behaviors.
We want our schools to be really inviting to come into. Kids are excited to come to school, and they need environments that allow them to do that.
When I walk in the hall or I hear from a colleague that they use one of our resources in the classroom and you see the kids laughing and they're moving and they're engaged and they're having fun at school, and when they're having fun they're learning, and when they're learning we're changing the world.
Through the TCI, it's been really amazing to see how change can happen in a community and can really transform lives.